Hi, everyone. My name is Emily Fields, and I serve in patient advocacy at ITF Therapeutics. And I'm excited to join you all today to share a little about ITF and to provide an overview of our approved therapy, Duvyzat, which many of you may recognize by its pre-commercial name, Givinostat. This presentation is broken into 4 parts. So I'll start by introducing you to ITF and to ITEL Then I'll provide an introduction to ITF's patient advocacy team. Next, I'll give an overview of the mechanism by which Duvyzat works in Duchenne. And I'll do this by highlighting our pivotal study EPIDUS and its phase 3 clinical trial data. And then finally, I'll introduce you to our patient assistance program known as ITF-ARC, where you can connect in for more information and for support. So ITF Therapeutics was established in early 2024 as a subsidiary of ITEL, which is a company that's been in business for more than 80 years. ITEL has a strong global presence in more than 90 countries. It is a family-owned organization and a privately held company with more than 12 years of experience in the rare disease space, researching treatments for Duchenne muscular dystrophy. ITF Therapeutics is based in the US. It is a new division of ITEL with a focus on the development and commercialization of products to treat rare diseases, including Duchenne. And we are headquartered in Concord, Massachusetts, and we're led by a team of individuals with extensive expertise in passion in rare diseases. Here you'll see our patient advocacy team at ITF. We're led by Caroline Allen, who is the head of patient advocacy and communications. And then Jules and myself serve as patient advocacy leads. And our team is dedicated to collaborating with patients, with caregivers, and with advocates to truly listen and learn and serve and support the community. So you'll see us engaging throughout the year at a variety of community events, and we welcome the opportunity to get to know each of you. So please, as you see us out and about, don't hesitate to come up to us, to introduce yourselves, and to provide feedback. We always want to hear from you all. So you can talk to us in person, but also our email addresses are listed here on the slide. Feel free to reach out to us directly at any time. And when we're not out in the community engaging with all of you, we are connecting with advocacy leaders across the Duchenne space. We're identifying ways to address unmet needs within the community. And we're sharing insights from the community back with our internal teams to ensure that we are always learning and we are always improving. Now to share with you about Duvyzat. So Duvyzat is an HDAC inhibitor indicated for the treatment of Duchenne muscular dystrophy in individuals 6 years of age or older, regardless of genetic mutation. It is a first of its kind non-steroidal treatment option for patients with all genetic variants of DMD. And we received US approval from the FDA in March 2024. So we'll start off with how Duvyzat works, or what's known as the mechanism of action. We know that individuals with Duchenne lack the ability to produce full-length dystrophin. In dystrophin-deficient muscles, an enzyme called histone deacetylase, or HDAC, is upregulated, which leads to increased inflammation, scarring, and fatty tissue deposits, which can cause, which contributes to the impairment of muscle regeneration. So Duvyzat helps to reduce harmful effects caused by the increased HDAC that we see in Duchenne. Our phase 3 EPIDUS clinical trial resulted in the approval of Duvyzat in Duchenne. The effectiveness and safety of Duvyzat was evaluated in this 18-month randomized, double-blind, placebo-controlled study. This study included 179 individuals with a confirmed diagnosis of Duchenne, and these individuals were randomized 2-to-1 to receive either Duvyzat or placebo. This was a twice-daily oral liquid suspension for the dosing of Duvyzat or placebo. And in the study, individuals ranged in age from 6 to 15 with a mean age of about 9.8 years. So here you'll see the key inclusion criteria for the trial. And this inclusion criteria was that individuals were 6 years of age or older and ambulatory. So they needed to be able to get up from the floor within 10 seconds for the time to rise test. They needed to be able to perform the 4-stair climb in greater than 3 seconds, but less than 8 seconds. And they needed to be on a stable dose of steroids for at least 6 months prior to coming into the study, and then commit to staying on that steroid regimen for the entire 18 months of the study. The primary efficacy endpoint was a change from baseline on the 4-stair climb test, comparing Duvizat to placebo at month 18. The mean baseline was 3.39 seconds, and then for those receiving placebo, it was 3.48 seconds. At 18 months, there was a change from baseline with those treated with Duvizat of 1.25 seconds, which was higher for the placebo group. This was at 3.03 seconds for the 4-stair climb test. This difference was about 1.78 seconds, which was statistically significant as well as clinically meaningful. So those who received Duvizat saw less decline than that of the placebo group. And then in addition to hitting the primary efficacy endpoint, there were consistent results in the key secondary endpoints. Individuals receiving Duvizat experienced less worsening on the North Star Ambulatory Assessment compared to those in the placebo group. So this result was characterized as nominal, but not statistically significant. Here you can see the safety data and the adverse reactions. So the most common adverse reaction for those receiving Duvizat compared to placebo were diarrhea, abdominal pain, thrombocytopenia, nausea and vomiting, hypertriglyceridemia, and fever. Only 2% of individuals discontinued the study due to adverse reactions, and most of these adverse reactions were reported as mild to moderate in severity. It's important to note that temporary treatment interruption and subsequent dose modification, if required, proved useful for the management of the majority of adverse reactions that were seen in EPIDIS. This is important safety information, or what's known as ISI. So what is the most important information for you to know about Duvizat? First, it may result in low platelet counts in your blood, which we call thrombocytopenia. It also may increase levels of fat or triglyceride in your blood, and it may result in frequent watery loose stools or diarrhea and vomiting. Duvizat may also cause serious side effects, including what's known as QT prolongation, which is a change in the electrical activity of the heart. Before taking Duvizat, we ask that you tell your healthcare provider about any medical conditions, including if you have any heart problems or if you're taking any medication that might cause an increased chance for irregular heart problems, or if you have any bleeding problems. As mentioned, Duvizat is FDA approved, and it's now available in the US for individuals with Duchenne who are 6 years of age or older, regardless of mutation. It is administered as a twice daily oral liquid suspension, and it's dosed based on an individual's weight. For more information, again, we ask that you please contact your or your child's healthcare provider or their pharmacist. All right, so we've reviewed the mechanism of action as well as the clinical trial data and important safety information. Now I'll share about our patient access program known as ITF-ARC. In order to be enrolled in ITF-ARC, you and your physician would complete our patient start form, which you can find at duvizat.com. Once you're enrolled, we have a dedicated set of case managers that work with you and begin the process with a review of your insurance. So they'll determine what your insurance requires in order to be approved for Duvizat, and this is usually called a prior authorization. We then work with the pharmacy and with your physician to submit all of the necessary paperwork. This process can include any documentation that's needed for subsequent appeals. And then beyond that, there are several access solutions that we provide through ITF-ARC. So this includes copay assistance, patient assistance programs for eligible patients who are either uninsured or underinsured, and a temporary supply program. Overall, ITF-ARC is really here to provide education and support throughout the entire Duvizat journey. So we encourage you to visit duvizat.com where you can find more information about ARC and the opportunity to connect with the program. Here is a QR code that will take you directly to the ITF ARC resource on duvizat.com. And so we encourage you to follow the link here and to learn more. And then finally, most importantly, we just want to thank all of you, everyone who participated in the clinical trial, and the entire community that's affected by Duchenne. We always welcome feedback from the community, so please don't hesitate to reach out. Again, at the beginning of this presentation, we shared the individual emails of our patient advocacy team. We welcome you to connect with us. You can also send emails directly to our team at generalinquiries@itftherapeutics.com. Thank you.